Uganda continues to face major challenges in its healthcare system, with limited health financing cited as a key obstacle to achieving universal health coverage. To address this, the Ministry of Health, in partnership with stakeholders, held the country's first ever national health financing policy dialogue under the theme Sustainable Health Financing Strategies for Universal Health Coverage and Resilient Health Systems in Uganda.
We improve private sector participation and partnership by integrating private partnership for health in both social sectors, including health regulations. And through incentives such as medical credit schemes, credit guarantees, among others, so that we can be able to attract and stimulate those who want to invest in the private sector.
What we are also seeing as a new trend is that the number of non-communicable diseases, that's your hypertension, diabetes, cancer, that is also going up. So in terms of what the government needs to prioritize, we need to prioritize funding for health. Funding for health has been lagging behind compared to where it needs to be. We have declarations like the Abuja Declaration, where the government is supposed to fund 15% of health needs as part of the GDP, but that has not really taken place.
Prime Minister Robinah Nabbanja, who represented President Yoweri Museveni at the event, underscored the importance of resource mobilization to improve service delivery.
I'm signing on behalf of Uganda.
Yes.
Uganda's population, like most African countries, is growing rapidly, and therefore the disease burden continues to rise. This is why it is important that we leverage innovative financing mechanisms in order to avert imminent crises.
Health development partners also emphasized the need for enhanced cooperation and sustainable financing mechanisms to strengthen Uganda's health system.
The government needs to prioritize health, and this will require making some hard choices in the budget discussions. Scale up what works, stop what doesn't work, and invest in high-impact, cost-effective models.
Meanwhile, the Parliamentary Health Committee urged government to increase the national health budget to match the growing demands in the sector.
It reflects Parliament's commitment to strengthen domestic health financing, reduce reliance on external aid, improve transparency, accountability, and value for money across this sector.
So for us, we are saying the policymakers must give us policies, and we must have the conversation. How are we going to start meeting the demands? Are we going to get private money? Are we going to invite commercial banks and commercial providers to resource the health that we need? Are we going to ask for health insurance? You know, even groups are getting together so that they raise resources so that we get more coverage and more financing for health.
It is hoped that adopting sustainable financing strategies will reduce the burden of out-of-pocket health expenses, which currently account for 40% of healthcare spending in Uganda. Adia Nakote, UBC.
The development partners